Today we'll be talking about the application of epidemiology to leadership. We'll define evidence-based management, identify the 5 domains of context that are relevant for public health decision-making, describe why evidence-based practice is vital to improving population health, explain how epidemiology is critical to systems thinking in the healthcare setting, and identify challenges to practicing evidence-based management. So leadership can be defined as both a science and an art. The science involves embracing surveillance, analysis, and expert systems for forecasting and planning activities. So for the manager, this involves keeping abreast of the literature on the prevalence and risk factors for disease, being able to implement and interpret needs assessments, and planning for human resource needs. The art portion of leadership involves having a talent for acquiring power, communicating a message, conveying respect, and sensing the proper timing for activities. Epidemiologic knowledge can contribute to referent power, also called admiration, within organizations. We talked previously about evidence-based public health, and here's a reminder slide on what that looks like. Basically, we start by assessing the community, quantifying and clearly defining our issue, identifying what's known about that issue, then using that to develop and prioritize programs and policies, then developing an action plan and implementing our interventions, evaluating the program or policy, and then returning to assessment. Evidence-based public health relates to evidence-based management in that they use some of the same tools, namely needs assessment and surveillance data, and also to evidence-based medicine, which we talked about previously when we covered clinical epidemiology approaches. And evidence-based medicine is really focusing on taking data from medical effectiveness studies and research on disease etiology to come up with clinical guidelines to improve practice. So an evidence-based management approach utilizes data and information on costs and on risk factors for disease to conduct analyses, to forecast, and to plan quality improvement activities. So this is really managerial epidemiology, which we've been talking about throughout the semester. The context for evidence-based management is important to consider, and it really mirrors the social ecological framework that we talked about at the beginning of the course when we were talking about public health approaches. But in this case, it focuses on the organization. So at the individual level, we still want to think about the characteristics of the people in our population, things like education, income, health history. At the interpersonal level, we want to think about their family history, potentially of disease or just of experiences, their availability of peer support, and then the level of social capital within the community. At the organizational level, we would think about aspects of the agency or healthcare setting, like staffing, the physical infrastructure, and organizational culture when making decisions. At the sociocultural level, that's things like social norms, values, and cultural traditions that might impact how people utilize and seek healthcare resources and their trust in the medical care system. And finally, at the political and economic levels, we want to think about that broader climate, what's going on politically and economically, what forces are shaping our behaviors and the availability of resources, and what indicators there are that might encourage us to make one decision or another. So here we see the context at the top. Sorry, it's a little blocked there. But thinking about in the context of all those different levels, what are the distribution of health, what health inequities and disparities exist within our population, what do we know about risk factors for diseases and the determinants of health, and then what intervention programs do we have available to us that can impact population level health. So leadership is really at the nexus of all 3 of those, and that in this case it involves public health decision-making and managerial decision-making to come up with a plan and programs that address all of those characteristics and features of our population in order to make the best decisions. On top of this, we need to think about systems. So people are not operating alone. Everything from a particular procedure all the way up to our healthcare facility is part of a broader system. So nothing is happening in isolation. And epidemiology can play into that, can be helpful in thinking about systems in the sense that there are relationships between risk factors. So often we see that risk factors for disease cluster together. So someone who smokes regularly may also be inactive. And these risk factors can act synergistically or antagonistically in some cases. So it's important to understand how they relate to one another. Also self-care behaviors, so how well someone is able to manage their chronic condition might be influenced by other types of behaviors, and they might often cluster together. So if we're developing programs to support self-care and encourage self-care behaviors, we might need to be aware of what other risk factors might be barriers or facilitators for engaging in those self-care behaviors. There are also relationships between diseases, so they often share risk factors and relate to each other in other biologic ways. So, for example, cognitive function, diabetes, and depression have all been associated with one another. And there are reasons, for example, high levels of insulin can actually encourage plaque formation that results in cognitive decline. So understanding how diseases relate to each other can also inform decisions that we might make at the organizational level around how we deliver care and what types of programs and services we offer to patients. Typically, healthcare systems are seen as complex adaptive systems, not just systems. And a complex adaptive system is a collection of individual agents with freedom to act in ways that are not always totally predictable and whose actions are interconnected. So one agent's actions changes the context for other agents. So basically, this makes it even more challenging to implement programs and predict what is going to happen within a healthcare setting. This is somewhat exacerbated by some of these principles listed here, the first of which is that people or agents within the system might act on instinct or ways that aren't always clear or logical to people viewing it from the outside. Agents and systems both change over time, and that the change in the behavior of the system is not linear. So small changes in one area could result in large changes in other areas. All that said, it's something to keep in mind, but try not to be completely overwhelmed by the fact that these systems might be difficult to understand and manage. But as a result, there are some challenges to practicing evidence-based management. One of which we have talked about a little bit over the course of the semester, that evidence isn't always clear or consistent. So we develop our understanding of risk factors and disease and interventions that work over time. So there are changes naturally in our understanding and what the evidence says. The evidence may also challenge standard practice. So this can be an issue for managers because at the individual level, clinicians or other providers may not be willing to change what they've done up until that point. And that willingness to change will vary across people and across groups. So it's important to evaluate and understand where people are coming from. Organizational factors also impact the ability to implement an evidence-based practice and also the fidelity to that evidence-based practice. And in turn, if you change the fidelity, if you change how you're delivering an evidence-based program, it may not have the same effectiveness that it had in the original trial that was used to develop it. And that can be disheartening to people, particularly if they were not supportive of the intervention in the first place. You want to make sure that you have a robust program and see the results in your population that you expect. So being an effective manager and coming into these programs and making decisions with input from others is often important. Finally, we frequently have unintended consequences, even when we're trying to improve practice and quality of care. So measuring them, being somewhat prepared for them, as prepared as possible, and knowing going in that they might happen and communicating with people about that is a challenge, but one that as a manager and as a leader is important to consider and address. In summary, evidence-based management involves using data on both effectiveness and cost to make organizational decisions. When making these decisions in public health or in population health, you must understand and address multiple levels of context, individual, interpersonal, organizational, sociocultural, and political and economic, and recognize that systems interact to influence health. Finally, epidemiology is critical to systems thinking in the healthcare setting because it clarifies and quantifies the relationship between system components, specifically among and between risk factors and outcomes.